At the Health Council of Canada, part of our job is to highlight innovative developments in healthcare that are enhancing the well-being of Canadians, our families, and whole communities. For most Canadians, the family doctor provides what we call primary healthcare. But not all Canadians have a family doctor, and many others have complicated healthcare needs that require the support of other professionals as well as their doctor. One solution to these challenges is collaborative team-based care, where a patient sees the doctor for the services that only a doctor can provide and sees other professionals on the team, such as a nurse or dietitian, for other healthcare needs. So the Health Council of Canada takes you to Peterborough, Ontario, where the team-based model has really taken off.
In 2002, primary health care services in Peterborough were stretched to the limit. 1 in 4 residents had no regular doctor, and our regional health care centre had the busiest single-site emergency room in the province. The picture was no brighter down the road. A growing population of seniors would present new healthcare challenges, but our family doctors were starting to retire, and there were no young medical graduates moving in to replace them. To head off a looming crisis, Dr. Don Harterre and a small group of family physicians started looking for solutions.
To attract new family physicians to Peterborough, we had to find a new answer to workload management. We had to stop being all things to all people. Yeah. I'm a physician. Why was I spending untold hours doing things that other health professionals were well trained to do while my waiting room was overflowing?
Essentially, what we were trying to do is get the right people to do the right things at the right time, so that you had a nurse practitioner dealing with the things a nurse practitioner could deal with, a doctor dealing with the things that only a doctor could deal with, a dietitian, a social worker. We have 80 physicians working in 5 teams in 23 sites throughout Peterborough City and County.
Initially, I was apprehensive about joining a family health team, but not anymore. I would never go back to anything but a family health team. In the last 24 years, this has been the happiest I've ever been in practicing family medicine. Working as a team, we see more patients, and I spend the time with them that they need.
I'm a social worker. I do mental health counseling. I see clients every 2 weeks for an hour per session. That's something doctors just don't have time for.
As a nurse practitioner, I meet many of the primary healthcare needs of our patients. I look after acute illness, I manage chronic disease, and I look after baby visits and prenatals. I do many of the things that our patients need. Basically, this increases public access to healthcare.
Partners in pregnancy.
Our multidisciplinary approach provides prenatal care and support to 6 weeks postpartum. It's a focused approach that means healthier mums and babies.
Many people take warfarin to treat blood clots and prevent strokes, but you have to get the dosage right. That's my job as a pharmacist. When the test went through the doctor's office, it often took 1 to 2 days to get the results. Now we have the patients in, the test completed, the correct dosage, and the next appointment booked, in and out in 15 minutes.
Buckhorn Health Center. And do you have a fever? Okay, I can put you in with our nurse practitioner this afternoon at 2.
Here in Buckhorn, just north of Peterborough, we have nurse practitioners, 2 MDs, and Allied Health working under one roof to serve 1,500 patients.
And do you tend to eat out a lot? Is that part of your lifestyle?
Yeah, because of my job. It would be sit down and eat, but I'd have to say
registered dietitians are on the forefront of chronic disease management. Before the family health teams, patients in Peterborough County had very limited access to nutrition therapy.
Mental health clinicians, like me, were few and far between, especially out here in rural areas. But now, people are getting the emotional support they need.
Today, Peterborough residents give their healthcare system top marks in patient surveys. Less than 2,500 residents are without a family doctor. That's down from 27,000 in 2005, and emergency visits have dropped by 15,000 per year. And there's a whole new priority on preventative care with innovative new programs to fight depression, diabetes, and vascular disease.
We're a family of 5 living here in Peterborough, and when our doctor left town about 3 years ago, we felt abandoned. We even considered leaving Peterborough. For every medical visit, we had to go to emergency, and it was a pain. But when the family health team opened up, the problem solved. We're staying.
We haven't solved all our problems, but we're certainly on the right track for the future.
What we've done can be replicated in any community, across Ontario, across the country, even internationally. It's not rocket science. It's getting the right person to do the right job.